Do you find yourself having difficulty with memory and decision making? Do you have sleep apnea? New research suggests that there may be a relationship between the two that we previously didn't recognize. We'll be talking about it on today's episode. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. I am so glad that you joined me. It has been a minute. I've been busy with some other stuff, so I have had taken a small break from posting episodes, but we're back today. And the information that I have to talk to you about today is near and dear to my heart and to my brain. If you're a long-time listener, then you no doubt have heard me talk about the fact that I have a disorder called obstructive sleep apnea. Now, obstructive apnea is a fairly common but widely underdiagnosed disorder of breathing that involves periodic interruptions in breathing during sleep. What happens is that the muscle tone in the upper airway, the back of the throat, relaxes as I go to sleep, and it closes off my airway so I can't breathe. My body realizes that I'm not getting any oxygen, so it disrupts my sleep in order to increase that muscle tone and open my airway. Now, this didn't start to happen all at once. I didn't wake up one day and say, oh, I've got sleep apnea, so I better do something about it. No, for me, it began in my 30s and gradually got worse as I aged and gained weight. Excessive weight is often an important risk factor, especially in men, for sleep apnea. Now, fortunately, since I work in the field of sleep medicine, I was able to recognize what was happening. My snoring was getting worse, my blood pressure was creeping higher and higher. I woke up with headaches in the morning, I was sleepy all the time, and my mood was terrible. One of the symptoms that bothered me the most was my inability to think as clearly as I used to. Since I was always sleepy, I couldn't concentrate or focus like I'd been able to when I was younger, or before sleep apnea began to take its toll. Now, all of these are common symptoms of sleep apnea. So, given that, I did what most men do when confronted with medical issues. I ignored it until I could stand it no longer. I finally got tested and found that I was holding my breath approximately 40 times an hour while I was sleeping. This was also associated with the drops in my oxygen down to as low as 85%. And typically our oxygen will stay around 95-96% while we're sleeping. So, I was diagnosed with severe sleep apnea, and I started treatment for my disorder as soon as I could. The treatment I chose was the use of a device called CPAP. It stands for Continuous Positive Airway Pressure, and it involves wearing a small mask while I sleep that blows room air at a specific rate into my upper airway. It keeps my throat open and gets rid of my sleep apnea. Now, I was fortunate in that at the time I was diagnosed, I didn't have a lot of the comorbid conditions that many people have related to their sleep apnea. I developed those a little bit later, but that is a podcast for another day. The comorbid conditions are other disorders that result from untreated long-term sleep apnea. Things like uncontrolled high blood pressure, diabetes, heart disease, systemic inflammation. Now, enter the study we're going to be talking about today. Recent research published in Frontiers in Sleep looked at a similar group of men that were newly diagnosed with sleep apnea, from mild to severe, between the ages of 35 and 70. And what's special about this research is that none of the participants had any comorbid conditions, and other than sleep apnea, were in good health. The results of the study showed that patients with severe sleep apnea had poorer vigilance, executive functioning, short-term visual recognition memory, and social and emotional recognition than the matched controls. Patients with mild sleep apnea performed better in these domains than patients with severe sleep apnea, but they still did worse than the control subjects. The authors conclude that obstructive sleep apnea is sufficient in and of itself to cause these cognitive deficits, which previous studies had attributed to the most common comorbidities, those things like the systemic inflammation and the heart disease and the diabetes. But what is the mechanism by which the obstructive sleep apnea causes the premature cognitive decline? The authors speculate that the cognitive deficits are due to a combination of intermittent low oxygen and high carbon dioxide in the blood, because as your oxygen drops, the carbon dioxide takes its place and increases in the blood. Changes in blood flow to the brain, sleep fragmentation, and neural inflammation in the obstructive sleep apnea patients. Dr. Rosenwig, one of the authors of the study, says, quote, "This complex interplay is still poorly understood, but it's likely that these lead to widespread neuroanatomical and structural changes in the brain and associated functional, cognitive, and emotional deficits." As I mentioned earlier, obstructive sleep apnea is severely underdiagnosed. It can occur in as much as 30% of men and 15% of women. So if you consider it, that's approximately 1 billion adults worldwide. So consider this a public service announcement. If your spouse is telling you you snore loudly and they see you holding your breath at night while you're sleeping, or if you consistently wake up with a headache and have begun to notice a decline in your cognitive abilities, talk to your doctor about getting checked for sleep apnea. It's a very simple process. They can refer you to a sleep disorder center. Sometimes they will even schedule at-home sleep studies out of the primary care doctor's office. So it can be a very simple process for you. But once you get that checked, if you are diagnosed and get that treated, your family will thank you. Your brain will thank you as well. I hope this has been interesting for you. Please remember to subscribe to the podcast on whatever platform you choose to listen to it to. And if you have any questions, comments, or if you have any suggestions for future episodes, please don't hesitate to reach out to me. You can touch base with me at j@somnilopod.com. You can also reach me through Instagram and Facebook. And until we talk again, please remember to make sleep a priority. Thanks so much.